Hey guys, Alex with RASA here. This is an exciting one. We're going to talk about how to set up for your live Zoom laparoscopic session. Now, guys, don't sweat it. Don't worry too much. This is going to be just fine. We just want to get some eyes on you and how you're doing your posture and everything, and just make sure that you're equipped and ready to go to clinicals. Okay. So, right off the bat, things you're going to need your endoscope, your 12 millimeter trocar, your laparoscopic view box with the closed skin fabric on top, a phone mount, your phone, your laptop, and your laparoscopic graspers and the endoscopic scissor that comes with them as well. Everything but your phone and your laptop come with the kit that we send you. So let's cut to the chase here. What are you going to be evaluated on? Okay, we have no secrets other than one, and that's the anatomical orientation. And all that is going to be is you're going to, once we get you set up on your Zoom with your phone camera as well as your laptop, both of them on Zoom, you're going to jump straight into the anatomical orientation by putting your endoscope and one grasper in to your view box. And we're going to call out for two specific organs or anatomical landmarks, and you will identify it by centering the image of the anatomical landmark with your endoscope, and then you'll just point to it with your grasper. That's it. Okay. The rest of it you've already done with videos you've submitted. You've done the peg transfer. So with that, you're going to use one hand on the scope and the other with a grasper and transfer a rubber band from one peg to the other. Slow is smooth, smooth is fast. Okay, guys. After those two skill sets, we're going to go straight into the last two. And this is kind of nice because what you're going to do is actually you're going to pull out your endoscopic camera and your scope, and you're actually going to loop it around this. I got the picture right here. You're going to loop your flexible endoscope around this handle that you see on your laparoscopic view box, and you're going to have it in a fixed position. That way you can see the next two skills that you need to do. Okay. And that's going to be the cutting with traction, countering traction, and the threading of the rubber band through the rubber band tunnels. Again, things that you have already done. So no surprises here. Okay. So once you get that set up, you're gonna use one grasper, one endoscopic scissor, and you're going to apply the proper traction, counter traction for a rubber band on one of those pegs, and safely cut the rubber band with your scissors. After that, you're going to move on to the threading task, where you use two graspers to thread the rubber band string through the rubber band tunnels in your view box. Really big thing there is just we want you to, through this whole thing, is just maintain accuracy and have steady movements. We don't want to feel like we're on a roller coaster. We don't want you stabbing your organs or anything. So if you do those things, I think we're going to be just fine. All right, last part of this rubric here. Again, no surprises. Things we're looking at: instrument handling, so use instruments safely and smoothly. Keep proper orientation, so horizontal awareness, hand coordination. And then, we're looking at problem solving. If you drop the object, lose orientation, or need to reposition, can you achieve these things? You will see this in surgery, so we want you to be able to problem solve during your video with us. Um, Communication and professionalism. So we do want you to explain what you're doing, especially when we ask you, and just kind of self-narrate yourself so we understand what your thought process is. Um, Utilize appropriate medical terms if you do use them. Stay professional, stay engaged, and then we'll look at your overall competency and complete all assigned tasks safely and effectively. And we typically want to see an 85% or higher on this, and we'll have the rubric posted in your RASA eCampus so you can have a look at that. All right, guys, so now we're going to jump back to actually setting up your Zoom. This task can seem a little daunting, be a little confusing. We're going to walk you through it. As you can see, we're back to this picture again. This is essentially all you're going to need here. So I have my laptop to the side, and I have my phone up top there. Some big things here, and I'll repeat them as I show you the videos on setting this up. Your laptop, your camera will be on, your mic will be on, and your volume will be on. Okay, that's where you will hear the instructor and be able to communicate with them. Your phone, your camera will be on, your volume will be completely shut off or all the way down, and your microphone will be muted. If you don't do those things, you will have microphone feedback, and you really don't want that. So make sure we take care of that. Okay. All right, so I'm going to share my screen with my laptop. Okay. Now, for your phone and your laptop, you're going to get an email to join the Zoom. So this part where you're going to see me typing in the meeting number, you're not going to need to do that. So just click on the link that you received from one of the instructor's emails, and you're going to join. Okay. We're going to get in here, click on the join. We're connecting. You see my ugly mug. There I am. And go ahead and click join again. Now we're in the video, and you at this point you'll be seeing your instructor, and next we'll move to the phone piece. But let's just kind of piece this out one by one. Okay. All right, so same concept here, guys. You're going to join Zoom from your phone this time with the link. You don't have to punch in the numbers like I'm doing right here. Once you're in, you're going to make sure that your sound is off and your mic is off, but keep your camera on. Okay, don't ignore what I'm doing here, tapping on those pieces before I join. But once you join, once you get into the Zoom meeting, what you're going to do with your phone is you're actually going to slide over to share. You're going to share your screen. Okay, the instructor will enable that. So click on share screen, and now your screen is being broadcasted. At this point, you're going to go ahead and put your phone on the mount, and you're going to plug in your endoscope like you have done before for sending your videos. And the same thing is going to happen when you plug that endoscope in. You're going to get that pop-up right there. You're going to hit allow. And now I can see you doing your endoscopic piece. I can see you driving the camera like we've talked about. Okay. I'll ignore that text message there. Sorry about that. We can do that now, and now we're solid. Okay. All right, guys. So at that point, like I said, we're solid. We have both cameras up and working. We're able to see your posture from your laptop, and you can communicate with us during it all. And we can see you can see us. And in your camera, like I said, it's already propped up, positioned, and you're driving your scope, and you can see it through your camera as well. And this is a really solid way for us to get those laparoscopic skill sets and check you off on them. Okay. So a couple things that I can tell you personally is it's really easy to slouch and all that. So make sure you're keeping an upright posture. You don't want to be hovering or leaning on the patient excessively, right? And the other thing is, if your arms and your shoulders are getting tired, make sure to tuck those elbows into your sides. If you have them out and about, it's kind of like doing lateral delt raises, and you're going to get tired. The delts on your shoulders, they're tiny, okay? So just be mindful of that. Good luck. You're going to do great. We are very much looking forward to sitting in with you guys and helping you guys through this, okay? You're going to be great. Thanks.